Bismillahirrahmanirrahim. Assalamu alaikum. Today, inshallah, I will cover the remaining part of the osteology. Okay, we have discussed the features of typical rib. Today, I am going to discuss the features of atypical rib. As I have told you that first rib, second rib, then 10th, 11th and 12th rib, these are atypical ribs because they have differentiating features or distinguishing features which are not similar to the typical rib. So first of all, I will discuss the first rib. Can you see this rib here? This is the shortest rib. Okay, this is broadest also. This is most curved also. Can you see this is most curved rib? The shaft of the first rib is not twisted. Okay, it is not twisted. Can you see the anterior end? Okay, this is the anterior end which is very thick. It is large and pitted. The posterior end is small and rounded. Okay, there are two borders. This is outer border and this is inner border. This is upper surface and there is the lower surface or the inferior surface also. The outer border is convex. Okay, the upper surface, can you see the upper surface? This upper surface will have two grooves. Can you see these grooves? Actually, there are subclavian vein and subclavian artery which are present here and which have produced the grooves on the first rib to show their presence. Okay, the anterior groove is for the subclavian vein and the posterior groove is for the subclavian artery. These grooves are telling us that this is superior surface. This is superior surface because on the inferior surface there are no grooves. So again I will repeat, this is anterior end which is large and pitted. This is posterior end which is pointed. This is inner border. Okay, the outer border is convex. This is superior surface. On the superior surface we have grooves. Okay, this is the anterior groove because it is closer to the anterior end. This groove is for the subclavian vein. Then there is posterior groove because it is more closer to the posterior end. This is for the subclavian artery. Okay, there is a scalene tubercle which is not very clear here. That scalene tubercle is over the inner border in between the subclavian vein groove and subclavian artery groove. That scalene tubercle is giving attachment to the scalenus anterior muscle. Scalenus anterior muscle. Then what will happen? Posterior to the subclavian artery groove, there will be another part or another insertion of the scalenus medius muscle. That is the attachment of the scalenus anterior muscle which is in between the subclavian vein groove and subclavian artery groove, and posterior to the subclavian artery groove there will be another attachment of the scalenus medius muscle. Then closer to the outer border there will be another attachment of muscle which is for the serratus anterior muscle. That is for the serratus anterior muscle. Then posterior to the scalenus medius muscle and in between the tubercle there will be lower trunk of the brachial plexus which is formed by C8 and T1. Okay, which is formed by C8 and T1. Again I will repeat, this is anterior end, this is posterior end, this is inner border, this is outer border, this is superior surface. On the superior surface we have two grooves which are for the subclavian vein anteriorly and subclavian artery posteriorly. In between the two grooves there will be a scalene tubercle here on the inner border which is giving attachment to the scalenus anterior muscle. Then there will be a groove or there will be attachment of another muscle behind the subclavian artery which is for the scalenus medius muscle. Okay, then there will be another attachment on the outer border which will be for the serratus anterior muscle. Okay, serratus anterior muscle. Now there is another point how you will remember if the grooves are not very prominent in that rib. So how will you identify that which one is superior surface and which one is inferior surface? So what you will do, you will put the rib on the table. okay, or you will place the rib on the table, and you will see that either the both ends, the anterior end and the posterior end, either they are touching the surface of the table or not. If they are touching, the both ends are touching the surface of the table, it means that you have placed the rib in the correct position, okay. Otherwise, what happens, if you put the inferior surface superiorly, the anterior end will touch the surface, but the posterior end will be lifted from the surface and it is not touching the surface. So it means that you have put the rib wrong. So you have to make it up, you have to make it in the opposite direction, so that the superior surface should be superior and the inferior surface should be inferior. Now, can you see the tubercle here? Okay, I have told you there is a tubercle on the outer border, okay, behind the head. This tubercle is very clear and very prominent in the first rib. This tubercle will articulate with the transverse process. Do you remember? I have told you tubercle comes from T, and transverse process of the vertebra also comes from T. So they will articulate with one another, okay. Tubercle of first rib will articulate with the transverse process of first thoracic vertebra. The anterior end will articulate with the first costal cartilage, okay, which will form costochondral joint, okay. The first costochondral joint will be primary cartilaginous joint, okay. This will be primary cartilaginous joint. Now, the posterior end having the head, can you see the head here? This head will articulate only with the T1 body, because every rib is articulating with two vertebra. One, the vertebra which is at the same level, and one vertebra which is higher to the that level, okay. But this rib will articulate only with T1. It will not articulate with the seventh cervical vertebra, because above the first rib there are cervical vertebra. So it will, above the thoracic vertebra there are cervical vertebra. So the first rib will not articulate with the cervical vertebra. The posterior end, so I have told you the posterior end having the head, the constricted part, neck and the tubercle, okay. Now there is no costal groove. This is the differentiating point or distinguishing feature for the first rib, that there is no costal groove on the inner part, or because there is no inner surface, there is inner border, but there is no costal groove. See, there is another difference also. In typical ribs we had what we have outer border, inner border, superior surface and inferior surface also. But here also we do not have costal groove on the inner surface. Here we had outer surface and inner surface, but here we have outer border and inner border. In the typical rib we had upper border and inferior border, superior and inferior border, but in the first rib we have inner border and outer border, okay. Here in the typical rib, I will repeat again, in the typical rib we had upper border, lower border. In the first rib we have outer border, inner border. In the typical rib we have surfaces, which what were the surfaces? Outer surface, inner surface. But where in here in the first rib we have superior surface and inferior surface, but there is no costal groove. These were the differentiating points for the first rib, which is first atypical ribs, okay. Now I will tell you one important point here. Are you seeing this part? This is the inner part of the neck. This inner part of the neck will give very important relation to you, okay. What is that relation? Here there are four structures which are present. Number one structure is sympathetic chain, okay. In Viva they can ask you what are the four structures which are present on the inner side of the neck of the first rib, okay. So we will go from medial to lateral side. Medially we have sympathetic chain. Number two, we have first posterior intercostal vein. Number three, we have superior intercostal artery. And then we have first thoracic nerve. First thoracic nerve. I will repeat again. First of all, we have sympathetic chain. Then we have first posterior intercostal vein. then we have superior intercostal artery, and then the first thoracic nerve. Okay, on the superior surface here near the anterior end we have attachment to the subclavius muscle also. Subclavius, that it means sub means below, clavius is for the clavicle, that is because clavicle is present above the first rib, so there will be a muscle which is subclavius, that is below the clavicle. Okay, so what are the attachments which I have told you? Number one, subclavius muscle, then there is a groove for the subclavian vein, then there is scalene tubercle having the scalenus anterior muscle, then subclavian artery groove, then serratus anterior muscle attachment, then scalenus medius muscle attachment. Okay, then there will be anterior to the scalenus medius, there will be lower trunk of the brachial plexus, lower trunk, not behind the scalenus medius, it will be anterior to the scalenus medius muscle, there will be lower trunk of the brachial plexus which is formed by C8 and T1. T1 will be the fourth structure which is present on the inner side of the neck, because there are four structures. What are those four structures? Number one, sympathetic chain. Number two, first posterior intercostal vein. Then there will be superior intercostal artery. And then there will be first thoracic nerve. So this was the first rib. Okay, now I will tell you the characteristic features of second rib. Okay, I will show you the second rib also, which is also the atypical rib. Here you can see again the anterior end giving attachment to the subclavius muscle. This is posterior end. Okay, having the head, neck and the tubercle. This is superior surface, groove for the subclavian vein, scalenus anterior muscle, subclavian artery, serratus anterior muscle and scalenus medius muscle. Now we will come towards the second rib. Are you seeing the second rib here? This is twice as length of the first rib. Twice the length of the first rib. The shaft is also very much curved. Okay, the shaft is not twisted, just like typical rib, it is not twisted. Okay, then tubercle. Can you see tubercle here? Is there any visible tubercle? There will be only a small tubercle which is giving attachment to the serratus anterior muscle, but the tubercle which is articulating with the vertebra is present here. Can you see this tubercle which will articulate with the transverse process of the second thoracic vertebra? Okay, the large tubercle is also a differentiating point or distinctive point for the second rib. This tubercle which is anterior, it will give attachment to the serratus anterior muscle. So these are some of the prominent features. Again I will repeat, the length is twice of the first rib, shaft is very much curved but it is not twisted. There is a large tubercle which will articulate with the transverse process of the second thoracic vertebra. There is another tubercle which is articulating with the serratus anterior muscle. Okay, so this was the second atypical rib, which is second rib. Now these are three links which inshallah today I will paste along with the video link. I will paste these links also. Please see all these videos so that this practical will become very clear to you. Okay, now these see this diagram. Can you see this diagram? This is first rib, this is second rib. Now this is the third atypical rib, which is 10th rib. Okay, 10th rib is shorter than the typical ribs which are present above it. Actually what happens, the length of the ribs will increase from first to second, then third, fourth, fifth, sixth, seventh, eighth and ninth rib. The length is increasing continuously. But when it reaches the 10th rib, it will decrease now. From 10th, then 11th will become more small. Then 12th will become more small. So this 10th rib is smaller than the 9th rib. Okay. Then it has a single facet on the head for the body of the 10th thoracic vertebra. Can you see the head here? Actually, this is the prominent feature of the 10th rib, that normally there are two demifacets on the head of the rib, but this rib will have a single facet for the, this will be a differentiating point. If I place two ribs in front of you, one is typical, which is maybe it is 9th, and one is 10th rib, which is atypical, there will be only few points from which you can differentiate. You will see the head of the rib. If there are two facets, you will say that this is 9th rib or typical rib, and if there is one facet, you will say that this is 10th rib or atypical rib. This is the prominent feature or differentiating feature from the 9th rib or the typical rib. Now we will come towards 11th rib. Can you see the 11th rib and the 12th rib? Okay, these are short ribs. They are floating ribs because they are attached only with the vertebra behind, but they are not attaching to the sternum anteriorly, so they are called as vertebral ribs or the floating ribs. They have costal cartilage anteriorly, which is pierced or which is merged in the abdominal musculature. Okay, this is anterior end, which are more pointed. These are short ribs. Can you see the length will decrease more when we goes toward 12th rib? Okay, they have posterior and anterior ends are pointed. Okay, neck tubercle are absent. There is no neck in these ribs. There is no tubercle. Can you see any tubercle here? There is no tubercle in 11th and 12th rib. Actually, if there is any tubercle present in the 11th rib, that will be very poorly marked, but in the 12th rib, the tubercle will be absent. Okay, so these are the characteristics or these are the features for the atypical rib. I hope you have understand. In this diagram, I will show you some of the relations for the first rib. Can you see? This is manubrium. Okay, this is the first rib. Okay, can you see the muscles here? This is scalene tubercle, which is giving insertion to the scalenus anterior muscle. This is scalenus medius muscle, which is present posteriorly. Here you can see the subclavian vein. Can you see the subclavian vein, which is crossing and producing a groove, okay, over the first rib. Then behind the subclavian vein, there is subclavian artery. And in between the two vessels, what is present? Scalenus anterior muscle is present. Then behind the subclavian artery, lower trunk of the brachial plexus is present, which is composed of C8 and T1. Then behind the lower trunk of the brachial plexus, there will be another muscle which is called as scalenus medius muscle. Okay, scalenus medius muscle. Now, I will tell you one clinical application. See here, this is cervical rib. What is cervical rib? Cervical rib is present above the first rib. It is present in about 0.5% of the humans. Okay, it is originating. Can you see? This is C7 vertebra. That is 7th cervical vertebra. And this is anterior tubercle of the 7th cervical vertebra. So it is originating from the anterior tubercle of the transverse process of C7. These are transverse processes of C7, and there is an anterior tubercle. From this anterior tubercle, the cervical rib is originating. Can you see the cervical rib? Maybe sometimes what happened, the cervical rib is free anteriorly, or maybe it is attached with the first rib through a fibrous band. Can you see a fibrous band here? Okay, the cervical rib can be present on one side or it may be present on both sides also. Okay, if there is any cervical rib which is accidentally, it will be diagnosed in any x-ray if it is done for some lung problem or any other problem. If the patient has cervical rib, so it will be seen in the x-ray. If there is cervical rib which is present, it can produce many problems to the patient. There are two main problems which can be produced. Okay, number one, it will compress the lower trunk of the brachial plexus. If there is rib which is present here, it will compress the lower trunk of the brachial plexus, which will produce pain on the medial side of the forearm and the hand. hand, and it will produce wasting of the small muscles of the hand. Number two, it can compress the subclavian artery also, okay, which will produce the symptoms of the subclavian artery compression. So this is cervical rib. In exam they can ask you what is cervical rib. Okay, now I will revise again the joints which are formed by the ribs, okay, because I am revising all joints which are formed by that bone. Okay, so I will revise the joints of the rib. See here in this diagram. Number one joint is costovertebral joint. Costo means rib and vertebra is for the vertebra. So costovertebral, which is formed by the head of the rib, there are two facets and articulating with two vertebra. This is costovertebral joint. This is plain synovial joint. Costovertebral joint, which is plain synovial joint. Number two, costotransverse joint. Can you see costotransverse joint? This is formed by the rib, the tubercle of the rib, and the transverse process of the vertebra, which is present at the same level. This is costotransverse joint. This is synovial joint. Okay, then we will come on the anterior end. Can you see this joint? This is costochondral joint. I have told before also that the first costochondral joint is primary cartilaginous, otherwise second to seventh this is costochondral. Costo for rib and chondral is for the cartilage. Okay, so there will be primary cartilaginous joint for the first rib, and then what happens? Can you see this chondrosternal joint? There will be chondrosternal joint. These chondrosternal joint is primary cartilaginous joint for the first rib and synovial joint for second to seventh rib. Second to seventh rib, and this costochondral joints are primary cartilaginous joint. Okay, I will repeat again. Costovertebral, plain synovial joint. Costotransverse is synovial joint. Chondrosternal, if it is first, so it will be primary cartilaginous. If it is from second to seventh, then they are synovial. Then costochondral, they are primary cartilaginous joints. Okay, so this was the second part of the osteology. We have covered the sternum, we have covered the typical rib, we have covered the atypical ribs also. Now we will come towards the third and the last part of the osteology. What is the third and the last part? They are vertebra, okay, which are forming the posterior part of the thoracic wall or thoracic cage. How posterior? Because these vertebra, which are 12 thoracic vertebra, they will form the posterior part of the thoracic cage. Okay, there are 33 vertebra in our body. Out of 33 vertebra, 7 are cervical. Cervical means they are present in the neck region, so they are forming the length of the neck. Okay, then there are 12 thoracic vertebra because they are present in the thoracic region. Then 5 lumbar vertebra, 5 sacral vertebra which are fused together to form one sacrum, and there are 4 coccygeal vertebra which will be fused together to form a bone which is called as coccyx. Okay, now we will come to again toward the thoracic vertebra only. Just like ribs, there are typical and atypical thoracic vertebra also. Just like ribs, we have typical ribs and the atypical ribs. Typical rib and the typical vertebra means they have same features or same characteristics which are present in all. But atypical means they have distinguishing features or different features which are differentiating them from the normal or typical vertebra. So in the typical vertebra, I will tell you the features here. Can you see the typical vertebra here? The vertebra of thoracic region will have a heart-shaped body. This is body which is present anteriorly. This is anterior end. How you will differentiate or how you will identify which one is anterior end and which one is posterior end? The anterior end is having a body. The posterior end is having many processes. So this will tell you that this is the posterior part of the vertebra and this is the anterior part of the vertebra. Number 2, how will you identify that this is superior surface and this one is inferior surface? See here in the side view, can you see the posterior process which is called as spine or the spinous process? Spine will go down, okay? It will be it is projecting downward. So this will tell you if the spine is projecting in this direction, this means that this is inferior part of the vertebra or inferior surface of the body of the vertebra, and this is superior surface. Okay, so how will you have to handle or you have to take the vertebra in your hand and you have to tell that which one is superior surface, which one is inferior surface, which is anterior end and which is posterior end. Again, see the cursor which I am moving, this is anterior end. Why this is anterior? Because it is having a body is always anterior. Then this is posterior end. Why this is posterior? Because there are all processes which are present at the posterior end. Then this is superior surface because the spine is in opposite direction, which is below, so this one is inferior surface. Now I will tell you, this was actually the side determination, that which is telling the anterior and the posterior and superior and inferior surface. Actually the vertebra, because these are median structures or median bones, so we will not ask you because there is no right vertebra or left vertebra. But in ribs we can ask you that it is whether it is the rib for the right side or the left side. So it is very important to know the side determination in ribs. Okay, but in vertebra, because we have single vertebra, or you can say we have a single line or a median line for the vertebral column, there is no right sided vertebral column or the left sided, so we cannot ask, or this is not the question that we will ask that which one is the right sided vertebra or the left. But remember these points for the ribs. Okay, see here, number 1 feature is body. Body is heart shape. How you will remember the body's heart shape in thoracic region? You know this thing that heart is present in the thorax, so heart shape body. Okay, if kidney is present in the lumbar region, so lumbar vertebra has a body which is kidney shaped, that is reniform. But thorax will have heart shaped body. This question will come in your MCQ also, that body of the thoracic vertebra is dash shaped, which is heart shaped. Okay, now can you see 2 bars which are coming out from the vertebra posteriorly? These are coming out from the body. See here, they are called as pedicles. These are rectangular bars which are coming out from the posterior part of the body of the vertebra. Okay, these bars, they will be going behind, and what they will do, they will be completing the arch. Can you see? It is forming a circular part. Okay, this is the circle. This is called as vertebral arch. This is called as vertebral arch. Okay, how this vertebral arch is formed? It is formed by the pedicles, and it is formed by another structure which is called as lamina. Okay, there are 2 lamina here. This is right lamina and this is left lamina, and this is right pedicle and this is left pedicle, and they are forming an arch which is called as vertebral arch. Okay, this is vertical plate of the bone. Now this arch is forming a foramen which is called as vertebral foramen. Can you see this big foramen here? This is vertebral foramen. Foramen means opening. Okay, there are certain contents of this vertebral foramen. What is the main content of the vertebral foramen? Spinal cord. Okay, along with all meninges which are dura mater, then arachnoid matter, then pia mater. All meninges are present along with the spinal cord which is crossing through this vertebral foramen. So what I have told you, number 1 body, then pedicles, lamina, vertebral arch, then this is vertebral foramen having the spine. Then we have a spinous process here. There is a single spinous process which is present in the center, and it is going downwards. Can you see? It is going downward. This is called as spinous process, and there are 2 transverse processes on each side. The spinous process is present at the junction of 2 lamina. The transverse processes, they are present at the junction of pedicle and lamina. Here also on left side it will be present in between the pedicle and lamina. So there are two transverse processes and there is one spinous process in every vertebra. Now there are another two processes. Can you see this process? These are superior. See here, these are superior articular processes and there will be poorly marked inferior articular process here. There will be superior vertebral notch, very small or very shallow superior vertebral notch, and there is a deep inferior vertebral notch. See here, inferior vertebral notch is very, very deep. This inferior vertebral notch, when it is articulated with another vertebra which is below, so it will form a foramen by the superior vertebral notch of the vertebra below. Okay, again I will repeat. See here, there will be superior vertebral notch above and inferior vertebral notch below. The inferior vertebral notch of every vertebra will be articulated or will be joining with the superior vertebral notch of the vertebra below to form another foramen or another opening. Okay, that is called as intervertebral foramen. The big foramen was only vertebral foramen and the foramen which is formed below is intervertebral foramen. And what is the content for the intervertebral foramen? Spinal nerve. Okay, spinal nerve will pass through the intervertebral foramen. For example, if this is vertebra 5, so fifth spinal nerve will cross below or on the inferior part or the vertebra foramen, intervertebral foramen, which is formed by the vertebra. It will cross through that foramen. Okay, I will repeat again. We have discussed the body. This is pedicle. This is lamina. We have spinous process. We have two transverse processes. We have two superior articular processes. We have two inferior articular processes. We will have the superior vertebral notch. We have a deep inferior vertebral notch. We have a vertebral foramen. We have a vertebral arch. Okay, so these are the features. Now can you see here facets? Okay, can you see this facet and this facet? What is the meaning of facet? Facet means little face. Can you see little face here? Demi means half and facet means little face. So this is a demi facet. Why this is a demi facet? Because half of the rib is attached here, not a full rib. Okay, half of the rib head is attached here, half of the rib head is attached here. Okay, so there are two demi facets on the head. This is the typical feature for the typical vertebra or distinguishing feature for the typical vertebra, that it has two demi facets on the body of the vertebra for the rib heads. Okay, for the rib heads, and it has a facet on the transverse process of the vertebra also for the articulation with the rib tubercle. If you remember, tubercle of the rib articulate with the transverse process of the vertebra. So this is the facet for the tubercle of the rib. Okay, demi is a French word. Okay, demi means half. Okay, because they articulate with the half rib. Okay, half rib. Now I will repeat again some of the features. Thoracic vertebra will have the heart-shaped body. Okay, and it has facets on the body. These facets are called as costal facets. Why they are called as costal facets? Because they are giving attachment to the rib. Costa or cost is the rib. These two features, that the heart-shaped body and the demi-facets on the body, they are representative for the thoracic vertebra. Because how will you differentiate between the thoracic vertebra and other vertebra? For example, cervical or lumbar vertebra, that there the body will be heart-shaped in thoracic vertebra. Number 2 points, there will be costal facets which are present only in the thoracic vertebra. They are not present in cervical, they are not present in lumbar, because ribs are present only in thoracic region and ribs are articulating with these facets. So these facets will only be present in the thoracic vertebra. Okay, now I will tell you which vertebra are typical thoracic vertebra and which vertebra are atypical. Second vertebra, third, fourth, fifth, sixth, seventh, and eighth. That is from second to eighth thoracic vertebra, they are typical. Okay, they are same, they are typical. But first vertebra, then ninth, 10th, 11th, and 12th vertebra, they are atypical vertebra. Atypical vertebra. See here. Now I will tell, there is one point which I have not tell. See here, there were two facets. Can you see these two facets? I will repeat again. The above facet will articulate with the corresponding rib. For example, if this is fifth thoracic vertebra, it will articulate with the fifth rib. But the facet which is below, it will articulate with the sixth rib. That is the rib which is below. Okay. Remember this point. This is very important point. Now I will show you a diagram in which there are features for the atypical vertebra. Can you see this is first vertebra? The first vertebra will be similar to the cervical vertebra because it is present just below C7. So this is first vertebra. The vertebral foramen will be very small. Okay, body will be not heart shaped. There is no heart shaped body in first thoracic vertebra. And can you see the facet here? Actually, there are two demi facets in typical thoracic vertebra, but here there is one complete facet, full facet, not a demi facet above and one demi facet below. Okay, because the above facet will articulate with the head of the first rib completely. Okay, complete rib head will be attached here. Okay, and this one, the lower demifacet, will be articulating with a half second rib. Half second rib. Okay, this is very important. Now can you see the spine? Spine is very thick, it is long, and it is more in horizontal direction than going down, because in the cervical vertebra the spine is horizontal, it is not projecting downward. So because this first thoracic vertebra is similar to the cervical vertebra, so some of the features are just like the cervical. Number one, the body is not heart shaped. Number two, the spine is thick and long and horizontal. Now we will come towards 10th thoracic vertebra. Okay, 10th one, it is resembling, okay, the 9th thoracic vertebra. Okay, only there is superior, complete superior costal facet. There is no inferior, because actually there are two costal facets, but this is the distinguishing feature for the atypical vertebra, that there are, see here, there is only one facet on the body, one facet in 11th, one facet in 12th. Okay, inferior facets are absent here. Okay, ninth one is this 10th one is resembling the 9th thoracic vertebra. Only superior costal facet, inferior one is absent. Okay, then we will come towards 11. In the 11 also we have only one superior articular or costal facet which is present. Okay, the transverse process is having no facet. Can you see any facet here? Transverse process is having no articular facet. Then we will see the 12th one. Can you see the 12th thoracic vertebra? 12th thoracic vertebra is also similar to the lumbar vertebra. Why it is similar to the lumbar vertebra? Because after the 12th thoracic vertebra, L1 is present. It has one costal facet on the body, just like other atypical vertebra, and it has the spinous. Can you see the spine here? It is not pointed. It is very thick spine, okay, which is resembling the lumbar vertebra. So this is 12. Only how will you differentiate between the 12th thoracic vertebra and L1? See here, on the 12th thoracic vertebra there will be one costal facet, but on the lumbar vertebra there will be no costal facet, because no rib articulate with L1, and otherwise the spines are very thick in 12th thoracic and lumbar, and there is no articular facet on the transverse process. Okay, now this was actually the presentation and the lecture, but I will tell you some of the clinical applications. Okay, number one is thoracic cage distortion. Now you know that how the thoracic cage is formed, but sometimes what happen, if there is any congenital anomaly or if there is any destruction during accident, so there can be fracture of the bones or the flexion of lateral flexion of the bone of the thoracic cage, which is called as scoliosis, or there can be change in the shape of the thoracic cage, which is called as thoracic cage distortion. Okay, there can be number two, there can be traumatic injury to the thorax also in accidents or in any other crushing injuries. What will happen? The bones of the thorax can be fractured. Number three, fracture of the sternum, okay, which is not very common because sternum is a resilient structure, okay, but it can be fractured in high speed motor vehicle accidents. Then there can be rib contusion. Okay, what can be there? Rib contusion, it means that the bruising of the skin over the rib. For example, if there is bruising over the fifth rib, so we can say that there is the hemorrhage which is present beneath the periosteum of the fifth rib, so it is showing the bruising, or it is called as rib contusion. Number five, then there can be rib fracture. Okay, what are the most common ribs which are fractured? Remember here, rib number five. Okay, this is rib number five. Then rib number 6, 7, 8, 9 and 10. 5 to 10. This is the most common question which is asked in Viva, that what are the ribs which are most commonly fractured. So rib number 5 to 10 are most commonly fractured rib. Why the upper 4 ribs are protected and they are not fractured? Because here the pectoral muscles are attached to the upper 4 ribs. So what will happen? They are protected and they are not fractured very commonly. And behind also, anteriorly pectoral muscles are present and behind scapula is present. So it is protecting the upper 4 ribs. Okay. Why the 11th and 12th rib are not fractured very commonly? Because they are floating ribs. They are not attached to the sternum. That's why they will be not fractured. Now tell me, what is the weakest point of the rib at which point it is fractured more commonly? This is angle. Okay, number 1 is angle and number 2 is costochondral junctions. They are the weak points which are fractured very commonly. Okay, actually what happens in children, the fractures are very rare because in children there is highly elastic thoracic cage is present. Okay, if there is any fracture in the rib, so underlying organs which are heart and lungs are also affected. Okay, in old age, actually what happens, there are calcium deposits in the costal cartilages, so ribs are very brittle and the thoracic cage will be more rigid. Okay, thoracic cage will be more rigid. Okay, so there can be rib fracture. If there is any rib fracture, it can penetrate the lungs also, or it can puncture the lungs also, so that the air can go, or if there can be another condition which is called air will come out in the pleural cavity. So this is called as pneumothorax. Okay, what it is called? It is called as pneumothorax. Okay, because there is puncture of the lung because of the fractured rib or penetrating rib injury. Now, what will be the symptom or the most common symptom which is present in the rib fracture? Okay, there is severe localized pain in the on the site at which the rib is fractured. For example, if fifth rib is fractured, so what will happen? There will be severe localized pain at this region, okay, which is showing that there is rib fracture beneath it. And what will be the treatment for that pain? We have to do intercostal nerve block, because intercostal nerves are the nerves which are present in the costal groove. They are innervating the periosteum of each rib, okay, above and below also. So we have to block, we have to give the anesthetic agent to that intercostal nerve so that it should not produce any pain. Okay, it is not sensitized and then it will not produce any pain. Otherwise they will produce severe pain in that region. Okay, I will tell you in next lecture how we can do the intercostal nerve block, what is the technique of giving the anesthetic to the intercostal nerve. Now there is another term which is called as flail chest. Flail chest means actually what happens if some part of the thorax is fractured. If there is severe crushing injury, these ribs, many ribs are fractured or they are broken. then what will happen? This part of the chest, it will be disconnected with the other parts of the chest which are normal. So what will happen? This is called as flail chest. This flail chest will produce ineffective respiration, because what will happen, with each inspiration the flail part of the chest will be driven inside, and in expiration this will come outside. So there will be ineffective respiration. Sometimes what happen, there is flail sternum, that is sternum is fractured and the rest of the thoracic cage is normal. So the sternum will be disconnected from the rest of the part, and the sternum will go in and out with the respiration abnormally. Okay, then there can be trauma to the back of the chest also. Okay, sometimes the scapula is fractured and the back of the ribs or the posterior parts of the ribs, they are fractured. And sometimes in the crushing injuries, what will happen, there can be trauma to the abdominal organs also, because liver is present, liver is also present underneath the lower part of the thoracic cage and under the diaphragm. So sometime what happened, the part of the liver or the stomach or the upper part of the duodenum or the spleen, most commonly the spleen, is punctured or they are traumatized in accidents. Okay, so this was the complete lecture. I have completed the lecture for the osteology of the thoracic cage. We have discussed the sternum, we have discussed the ribs, we have discussed the vertebra. So now it is completed. Inshallah, in next lecture we will go and we will proceed further. Thank you very much.